We're here to talk about feeding. Most mothers have chosen to breastfeed. Some mothers struggle to keep breastfeeding. Breastfeeding is the natural way to feed a baby, and most parents will be well aware of how much goodness there is in breast milk and that it is the healthiest way to feed their baby. One of the biggest problems mothers tell us is the confusing advice that they receive. Parents receive a lot of well-meaning advice from family, friends, and places like magazines, as well as health professionals. The advice can conflict as it can be based on myths and anecdotal advice. In other words, stories that their friends feel have worked for them. While a lot can be helpful, it also can be jolly overwhelming. So the aim of today is to give some clarity to newborn feeding. We will go through those essential bits of information which will give new parents the confidence to look after their baby. The most important question mothers ask is when to feed their babies. That is an important question. Babies give signs that they want to feed, and those signs will be that she's starting to think about food and that she wants to suckle. Babies go from a deep sleep into a lighter sleep, and as they start stirring, they tend to start licking their lips, popping their tongues out, moving their fingers to their mouths, and if you're holding them, they will nuzzle in and root for the breast. Our advice would be, the best thing is to respond promptly to those feeding cues and put the baby to the breast. If you delay and start changing her nappy, she'll then get cross and start crying. Trying to put a crying baby to the breast is far harder than when they're only just beginning to think about feeding. So, to recap, when babies root, it means they'd like to suckle, and the best thing is to feed them promptly. Nipples are full of nerve endings, and if they're shallow in a baby's mouth, then they do get damaged, and that does hurt. Babies breastfeed and not nipple feed. This means that the baby must be able to open her mouth really wide, gape, and must be able to take a large amount of breast into their mouth. When they go onto the breast and the nipple is then far back in the mouth, it shouldn't hurt. This means that in the early days there can be times when the nipple does feel sore and does hurt, but practice really does make perfect. Our advice would be to ask the health professional looking after you to show you how to attach the baby. This means getting the baby in the right position so that she can open her mouth fully and attach to the breast successfully, so that's comfortable for you and her. Firstly, ensure you're comfortable. You hold your baby close to you and with her head and body in line. You bring your baby to your breast with her chin leading. Support her firmly in the shoulders and allow her head to tip slightly back so that she can open her mouth. It can help to think about how you have a drink. Your head goes back and your chin comes forward as you drink. Your baby needs to be able to do this too. Your baby has a perfect groove on her top lip for your nipple, so aiming your nipple at her nose, prepare for her to open her mouth wide as she does quickly put her on. She'll go on at an angle, and it does seem strange to not aim your nipple directly into her mouth, but by going on at an angle you will get more breast beneath the nipple, and that means she'll milk the breast more effectively. Newborn babies have very small tummies, and in their first 24 hours are recovering from the birth. They're well fed from the placenta and hydrated from the amniotic fluid that was in their lungs and gut when they were born. This means they need loads of skin-to-skin time with their parents as they get used to life outside of the womb, lots of cuddles. However, they also need to practice their feeding skills. Although they don't need large quantities, they do often have times when they seem to want to suckle for hours on end. Mothers have a milk-making hormone called prolactin. Babies know that, and the more they suckle, the more prolactin there is, which makes sure mothers have plenty of milk. After they are a day old, they still need to suckle to stimulate their mother's milk supply, and although they still don't need large amounts, they do need to feed at least 8 times in 24 hours. Most newborns feed regularly during the day, then they want to spend hours feeding, which is called cluster feeding, and then they might have a longer sleep before the next feed. We advise mothers to follow their baby's lead, watch them closely, and when they root, feed them promptly. This can mean you're feeding them every 2 hours, but avoid watching the clock and don't make them wait for a feed. The trick is to ensure they're getting a minimum of 8 feeds in 24 hours, as well as a period of cluster feeding, which generally is in the evening / nighttime. Nighttime feeding is essential to promote mother's milk supply. Periods of cluster feeding is also essential as it's baby's survival strategy. It's entirely normal. Although it's normal, it often makes parents very anxious and they think their baby is not getting enough milk. To recap, your baby needs at least 8 feeds in a 24-hour period of time, plus a time in the day when they have lots of little small feeds. Babies don't have a certain time that they feed for. Some feeds are short and some longer. Just as we sometimes snack and sometimes feast. Your baby maybe wants a quick drink or a big meal. Babies do get more efficient as they get older, so you may find feeds getting shorter. The key is that the baby is removing the milk she needs. You will know this by feeling your breasts become softer. This is usually more obvious in the morning when the breasts are fuller. As the baby feeds, the breast gets progressively soft. As the feed progresses, your baby gets fuller and more satisfied. The pauses between the bursts of suckling get longer and the baby may appear to be going to sleep. Allow the baby to feed for as long as she wants to and as long as you can see the baby is feeding. Babies are very good at portion control and breast milk is very soft on their tummies, so allowing them as many opportunities to feed is a good idea. Our advice is to respond to feeding cues quickly. Feed for as long as baby wants on one side and then offer the second side every feed. This way, the baby gets as much milk as they need when they need it. To recap, babies feed as long as they want on one side and then you offer the second side each feed. Mothers worry that their baby is getting enough. All of breast milk can be digested. Therefore, if your baby has wet and dirty nappies, they are getting enough milk to grow well. A sign you're feeding well per feed is that your breasts become softer during the feed. A sign you're feeding your baby well per day is that your baby has wet and dirty nappies. And a sign you're feeding your baby well over several days is that they're mostly content and gaining weight. We know that breastfeeding requires mother and baby to work together, so if you're following your baby's feeding cues, feeding on demand, ensuring they get their 8 feeds in 24 hours, allowing them to cluster feed, and you don't have sore nipples, and you're offering the second breast every feed, your baby is content most of the day and there are lots of wet and dirty nappies, then you're doing a really great job. To recap, input equals output. Mothers worry about remembering all this information. It's important to understand that it takes a few weeks to get breastfeeding established, as long as 6 weeks, and that there will be good days and less good days. If you're having difficulties with feeding or even finding it difficult coping with a newborn, it's important to talk to people about it. There are feeding support clinics in most areas, and locally here the infant feeding team as well as volunteer groups who specialise in offering feeding support. The list of clinics and support groups will be in Mother's discharge packs. Your community midwife, your health visitor and GP are sources of support. Enlist your closest and dearest for support too. Having a baby is a steep learning curve and a rewarding full-time job. So to recap, learning to feed and getting feeding going well can take a little while.